Knee replacement surgery replaces damaged knee joints with artificial implants to relieve pain and restore mobility. Benefits include significant reduction in chronic knee pain, improved mobility and daily function, and a better quality of life for patients with arthritis or severe joint damage. Relieves chronic pain, restores mobility, improves quality of life. Risks include infection, blood clots, implant loosening, or persistent pain. Recovery takes weeks of physiotherapy, and some patients may need revision surgery later. Infection risk, blood clots, implant issues, long rehab period. Surgery is recommended for patients with severe osteoarthritis or joint damage who do not respond to medications, injections, or lifestyle modifications. Severe arthritis. Failed conservative treatment. Limited mobility affecting daily life. After surgery, follow your physiotherapy routine daily. Avoid high-impact activities or heavy lifting. Keep the incision clean and attend follow-ups. Manage pain with prescribed medications and gradually increase mobility. Avoid heavy lifting. No high-impact activities. Take prescribed medications. Follow physiotherapy exercises.